tonight's Health Watch, new way to perform radiation therapy for lung cancer.
It spares normal lung tissue while hitting the tumor with fatal doses of radiation. CBS 2's Dr. Max Gomez here now with more, and this sounds like a GPS, really, for these tumors.
You know, that's not a bad way to think of it, actually, because this new technology tells doctors and the linear accelerator producing the radiation beam exactly where the cancer is in the lung. That's key because you only want to irradiate the tumor, and it keeps moving when the patient breathes.
I had a slight cough originally with some mucus.
That cough and some unexplained weight loss was enough to get 83-year-old Larry Darkole's doctor to look further. A series of tests and scans revealed a small tumor in the upper lobe of Larry's left lung. Now what?
I didn't want to have surgery.
The other option was radiation, but as Dr. David Dubin, chief of radiation oncology at Englewood Health, points out, irradiating a lung tumor is tricky.
The lung is very sensitive to radiation therapy, and it's moving. Every few seconds, a person's taking a breath. Therefore, the tumor is moving in all different orientations, and we have to be able to follow that.
That's where this Calypso radiation system comes in. It's a sophisticated combination of technologies that allows doctors to track exactly where the tumor is in real time. First, 3 tiny locator antennas are placed via a lung scope around the tumor. Then, when the patient is in the radiation therapy suite, the Calypso machine is tracking the tumor 25 times a second. If breathing moves the tumor outside the radiation beam, the beam instantly shuts down. When the tumor moves back into the target zone, the beam reactivates. Medical physicist Dr. Michael Spicer showed me Larry's tumor and one of the locator antennas on an X-ray.
We're able to spare more healthy tissue, but at the same time provide the confidence that we're hitting the target.
The Calypso beam and the table both move around, hitting the tumor from all sides to deliver a maximum killing dose to the tumor in just 3 sessions a week apart.
We know that it works more than 90% of the time, and over the course of the many months, you'll see the tumor go away.
Larry just finished his 3rd treatment, and he's no worse for wear.
He said I would feel a little tired. I'm okay. I'm 83 years old. I bounce around.
Not bad for 83. Now, the Calypso is meant for patients like Larry with small, early-stage tumors or patients who are too sick to have lung surgery, so radiation is their only option. What we don't know exactly yet is how this radiation compares with surgery for those early-stage tumors. And finding those early tumors has actually become much more common because now they're doing these sort of low-dose CT screening for people who've smoked for a long time, and they're finding these small, early-stage tumors where before, you know, people didn't show up until they had big tumors that had already spread throughout their body.
Helps to have a good attitude like Larry there, too,
He's
right?
got a great attitude.
Sure does.
You bet.
Thanks, Doctor.
Thank you, Dr.